Alright guys, welcome back to another episode. Today we are in the lab, which is what I call it. It's actually my home, in my basement. I'm actually here with my physical therapist today, Dr. Pete, who has been working on me for several months now, working on Graston, cupping, ART. These are the type of things I've been doing for the past 3 years, guys, and these are what has dramatically improved my physique, my training, my recovery, my whole entire 9 yards, and the biggest thing for me is longevity. So getting things like this done on a regular basis, again, has elevated me to that next level. Dr. Pete, I'm going to let you guys listen to what he's talking about today. He's going to talk to you about what we're doing exactly.
What's going on, everybody? Dr. Pete Cuviello, PT and owner of Sports Bar Physical Therapy. I am PT in the Northern New Jersey location. So if you guys are athletes, I specialize in athletes, and here I got the best athlete possible working on recovery and maintenance. Before I get started, I just want to thank Shaun, for having me a part of his team. Allowing me to bring my expertise in recovery and maintenance work, to help you, succeed and to optimize your performance on your road to Olympia. So thank you.
Thank you.
You're welcome, of course. For those who are watching, if you're interested in physical therapy, there's always a misconception. People think to get the services or the sessions that you have to be injured. No, not necessarily. I work with a lot of clients, bodybuilders, other athletes that, this is more of a recovery and wellness work, so they're optimizing their overall performance with their training if they have a competition such as the Mr. O. So, recovery is really important. If you don't have that recovery, session set up in your wellness program, I definitely recommend it. I mean, Shaun will tell you and attest to, how much of an impact that has been on his road, his career, and now into training for Mr. Olympia. This is what keeps him going each and every day to prevent any injury and to succeed on the stage. So we have a lot of content for you today. Stay tuned. If you have any questions or concerns along the way, reach out to me or Shaun and we'll be able to answer those. But stay tuned because we have a lot of good things going for you today.
And just to piggyback off what P had said, again, guys, this isn't something you want to do when you get injured. Again, I've been doing this since 2017 on a weekly basis. And I just did it initially just to make sure, again, I'm recovering. My body's recovering where it needs to be. I'm able to train at 100% and to prevent injuries from happening. Because God forbid I do get injured, at least I've been doing the maintenance work prior. This way, if I do get injured, any type of nicks or tears here or tweaks here and there aren't as bad because I've been taking care of my body on a regular basis. So we're going to get into it, guys. You're going to see exactly what I've been doing, again, for the past 3 or 4 years now, getting worked on, Graston, cupping, ART, whatever Dr. P has in store for me today. So stay tuned.
What's going on, everybody? So for those who are interested in the sessions that refer recovery or maintenance work, typically what it works like is hands-on work. We did have different techniques that we're going to utilize today, whether it's Graston, cupping, all to help to prevent injury, kind of to see how the muscles are working efficiently, and also to look at certain areas that are maybe more susceptible to injury or not. So today we'll be going over everything. I'll be explaining those things and kind of working on some areas that maybe be limited for Shaun and kind of talk about why that they're limited, especially being a bodybuilder and lifting overhead. So the first thing first, what we like to do is always assess, kind of see where our baseline is. So first we're going to focus on Shaun's shoulders to kind of open him up, especially with posing and lifting. We want to make sure that you're getting full range overhead, because if you're not, you can be risking injury, creating more compensation somewhere else, causing pain or discomfort, or even worse, overtraining, maybe a rotator cuff tear or something like that. So we want to screen first so we know what we're working on. So Shaun, let's do this first. What I want you to do, hands straight out in front of you, I want to reach all the way overhead. Just let me know if there's any pain or discomfort. Go as far as you can. So as you can see, his left shoulder it doesn't go as far back. Is there any pain or discomfort there?
No.
Just tightness? So as you can see, there's some tightness going on. Typically what happens sometimes when people have tightness in their shoulders, you'll see that their elbow bends or they can't get all the way down. And that's just showing me that some of the lat, which is a big muscle in the back, is restricted. So we need to loosen that up, but also into the pec too. The pec kind of is a protractor. It brings your shoulder forward. So if it's not easy flexible, it's going to restrict how much you could go overhead. And Shaun will tell you over the times we found that there's a lot of tightness and restriction through his pec that limits him when he's reaching overhead. And especially with posing, if you can't get back into your, double front bicep pose, then we're limited. You lose points, and everything 1 or 2 points is the difference between winning, right? So we want to make sure that all of that is squared away before the competition. Good, relax. Now let me just reach in here. So I'm just using my hands just to kind of feel the muscle. It's very bounded down through the pec tissue, specifically towards his collarbone. And that can just be limited, with just the amount of training, the volume, doing a lot of bench press or just flies in general, and it restricts you. So we want to just open that up. So I just feel in here and kind of pinning down the tissue as I stretch. And it can be very uncomfortable for some depending on how tight the tissue is. As Shaun you can see from his facial expressions, it doesn't feel so great. But that's only temporary for the long benefit of, loosening the tissue up so that you're not in any pain or discomfort while training. Doing okay?
Yeah. Ease up a little bit. That's good.
Yeah. So just going through the whole pec fibers, down into the sternal fibers, just to really open you up. And I know we've been doing this for a while now, so Shaun is, feeling better. He's in a good line for Mr. Olympia. But in the beginning, we had some difficulty reaching overhead where we're getting some pinching sensation to the front of the shoulder. Which limited, sometimes how much he can lift, and it's important each time when we go into the gym that we're giving it 100%. And so this type of work, the recovery and maintenance, is what's going to allow you to do so and to prevent any risk for injury. Good. Good, relax. Now the fun starts.
Oh, shit.
So just using some lotion just to prepare the tissue. Good.
Fuck.
So we're going into some shoulder external rotation as we're pinning down the pec fibers. So this is obviously very important, if you're doing, any military press or overhead pressing, but also in terms of posing as well. People need enough external rotation to get into the front double bicep pose, and if you can't get in there, you're going to be losing points.
Ooh.
There you go.
Ah.
And I think what the biggest thing too is, as you train, you obviously depending on what your goal is, for the bodybuilders is to build size, right? But you have certain muscles that are bigger than other muscles that, over dominate sometimes. So with the pecs in particular, they can pull you into a more forward position in your shoulders. And so when you're trying to reach overhead, you can actually cause a rotator cuff injury based on, posture being impaired by a muscle that is more tight and, not putting you in an ideal position. I mean, Shaun, you probably could attest to this over the years, how important it is, to do this kind of work, if there's any type of nagging injury, you want to be proactive. You don't want to be reactive, meaning that you don't want to react to there being an injury. You want to be proactive to prevent any injury and to continue training full force. You have one body, so it's important to take care of it the first time. It's just like training. Training is equally important, just as eating properly, sleeping properly, hydration. All of those things are equal weight. They all work on the package of getting you to perform the way you need to perform so that you're healthy and you can show it all and non-stop on the stage. You're not leaving. There's no plan B. You're leaving everything on the stage, and that's what you worked hard for over the years. If you don't do that and you can't show off all that hard work, then everything goes to waste. And then you're left with, what was that all for? And that can make you or break you.
The one thing we talked about this, and kind of how I see things now is, as bodybuilders, we're continuously packing on muscle, right? But if we're not going in and opening that muscle, increasing the blood flow, stretching that muscle, eventually over time, one, you're going to stop growing because there's nowhere to go, and two, it's going to easily cause a tear or an injury because it's so bound up. So getting the work done to be able to open up the muscle, let it recover, get more blood flow in, the whole 9 yards, that's what's going to allow me to, again, continuously put on muscle, but again, stay healthy and be able to train fully every single day.
Yeah, 100%. And I think the also thing is, every time you go to the gym, while you're laying down new tissue, there's tears that go on, small tears. That's how muscle grows. But over time, if you keep on training and training and training, your tissue doesn't heal appropriately. It never has time to recover, especially when you're in the gym, 5 to 6, 7 days a week. You need time to add to the recovery and the maintenance work to allow for that tissue to heal, to keep on growing healthy. Good. So now we're going to do some Graston work. Other people call it scraping. It's another form of a manual technique other than my hands. It's a stainless steel to kind of help to loosen up all the adhesions. Again, just trying to get blood flow to that area to open up the muscle and show it all off, right? So again, you're just going to relax. You're going to hold your hand up here. Good. So with this, the type of technique, you have to do it right. People, while it is discomforting, you can see by Shaun's facial expressions, if you don't know what you're doing, you can create a lot of trauma to the tissue where then the tissue is not healing properly. This is just trying to open up everything. As you can see, the tissue is starting to get red, which is just kind of bringing blood flow to that area to allow for the tissue to heal. But also, along as I go along his tissue, there's a lot of bumps, and those bumps are like adhesions. So as tissue grows, it's laying down new tissue, but that tissue is almost like a scab underneath the skin, and it's just new tissue that's trying to heal, but it's not organized, meaning it's not healed properly. So it kind of creates a restriction or a tightness, or like almost like a trigger point that some people say. So this is just another way to open up the tissue to show off mobility and get into certain overhead positions that if you can't because of a limitation because of the soft tissue being tight.
Fuck.
And basically, there's different ways of using this, going with the grain of the tissue and going against. It's just to kind of really open up the tissue, all the fascial tightness through the tissue. So fascia is just a connective tissue that surrounds the muscles, the skin, the blood supply. It basically gives everything its own compartment. And if things are kind of all bounded down, you'll be rigid. You can't move. You can't show off all that hard work, as I was mentioning before, on stage. And that can limit you and cause restriction, pain, or even an injury if not addressed. Get a little lotion in there. You okay?
Yeah, I'm good.
Shaun's tough. This is not for everybody.
Hell no. Oh, man.
Big arms that wide. Yeah. So now we're just going more into his sternal fibers, just to kind of open them up even more. It also helps with breathing. People don't realize, breathing is really important. If you saw Shaun's last video, part of his posing dealt with breathing and being able to breathe properly to really show off the muscles. If you're holding your breath, you're not really magnifying, or showing off like the muscles, true capabilities. You're actually limiting yourself to really kind of make them pop. But also in terms of just training, if you're not breathing properly, you become lightheaded, it could, you're not getting the nutrients that's needed for the tissue to grow, so on and so forth. So this is just another way to open him up so he's breathing properly as well. And I'm sure, Shaun, you could, tell the audience, how it was hard, in the beginning, kind of working on your breathing, and with your posing. It's just training things. And so if you could train the muscle to open up, it's going to make your breathing a lot easier to hold those poses.
It's just control.
Yeah.
It's all about control.
Good.
Okay. Good.
So now what I want you to do, we're going to do almost like an active release, or people call it ART, but I call it just an active release, or pin and stretch. So basically what I'm going to do now is just kind of pin down Shaun's pec tissue as he works on going overhead. So by tacking down the tissue is basically going to open up the pec fibers even more and kind of create a muscle memory. Now he's connecting his brain to the action of the muscle, so it hones in on the new ranges, the new movement that we have acquired through all that soft tissue work. Ready?
Yep.
Good. So again, we're just opening them up. Good, nice. Let's do 3 more.
1, 2. Oh, awesome. Definitely feels much looser.
Good, I want you to raise all the way overhead.
Oh, hands. Oh, you can see the difference right
Yeah,
there. I can feel the difference.
That's a big difference.
So the left is a lot lower than the right. I can touch this, right?
Yep.
The right, I can't touch.
Right, before you were here,
Yeah.
and now you're more equal to your right side. So that's just shows you, and this is just, 5-10 minutes of working on Shaun. Depending on the area, certain areas require more work. So I delegate, my time to certain areas versus just spending all my time on one area. It's about efficiency and sequencing of things to make sure, okay, where are the restrictions? Where do we need to focus on them? And then delegating the enough amount of time to those areas, but not too little where he's not getting any benefit at all.
Yes, sir. That's good.
Let me see your rotation.
Okay. Same, both sides?
Yeah.
It was worse before from the beginning. It was
definitely better. Yeah.
Lat?
I'm gonna get more into like the subscat first, which is like right down into the armpit.
Oh, that sucks. I hate that area. Fuck.
So basically, subscap is a rotator cuff muscle that protects the shoulder from within the shoulder blade, so it's more deep in nature. Yep. So. You're okay. All right. So basically, the rotator cuff, the subscap, is very important to keep your shoulder nice and stable. It's one of 4 musculatures that help to hold the bone within the joint. God, I can't speak today. To keep it nice and stable as he reaches overhead. Again, its job is to prevent the bone from shooting forward. So anytime you're doing like a fly and you bring your arms back to kind of lengthen that tissue, if that muscle is not working efficiently, your bone can shoot forward and you can dislocate your shoulder. So this is just a way of loosening that tissue up a little bit, just because when it does become strong or over tight, it pulls your humerus sitting more forward within the joint, and that can, create pinching as you reach overhead.
Shit.
Good.
That is the worst spot ever.
Yeah.
Fuck.
And again, you got to be very careful into the armpit area. Obviously there's a lot of nerves and vasculature that's in there. So always making sure that, my clients don't have any numbness or tingling in their hands. Are really important to monitor, because if you're just jamming in there and you don't know what you're doing, you can really hurt somebody. And, obviously that's not good. We're trying to prevent injury, not cause injury.
Okay.
Fuck. So what I'm going to have you do, I'm going to have you move it more overhead. You're going to go, yep.
Like this?
Yep, exactly.
Go back and forth?
Yep, back and forth. Let's do 10. And as Shaun moves, I can feel the different fibrous bands within the subscap, which are just now, as he's going, are loosening under my hand, but they're very bounded down. And that can just be from training. That is all normal. We just want to make sure that the tissue is flexible, to really allow the muscle to show off and have the proper length or flexibility necessary for someone to reach overhead, while you're lifting. Good.
Ooh. Definitely got deeper, or a lot more further back.
Yeah, that's definitely good.
Yeah. Good. Like, again, I can touch here. Just touch here.
Yeah. So what's also really good, other than just soft tissue, the biggest thing is also looking, how the joint moves. So while the soft tissue can be a limiting factor for range of motion or your movement pattern, the joint can be too. So it's important to look at both things. So the next just couple of techniques I'm going to look about is basically how the shoulder moves in terms of the joint. So Shaun's just going to relax, and I'm just putting my hands here and kind of just assessing how the joint moves efficiently. So this type of technique, obviously, you have to know what you're doing again, because if you don't, you can dislocate someone's shoulder. So basically, by me putting in a downward force kind of towards Shaun's like hip to his foot, it's just trying to open up the joint a little bit. And this is going to allow him to reach overhead to really show off his posing. Getting those muscles, the joint working efficiently is key, so that we reduce any risk of injury. And Shaun will tell you, sometimes we do soft tissue work and he's still limited. So then we go into the joint where we're like, wow, the joint itself is not working efficient. Let's get in there. And then once we do the joint movements, and mobilizations, the whole package is there. Now we've loosened up the tissue, we've loosened up the joint, and now he's able to reach overhead without any limitations at all. And sometimes too, like people get like some pinching pain in the front of their shoulder when they're reaching up, and it's like, okay, I reach, I get some pain, and then it goes away. That's like impingement. So the way mechanically the shoulder works, it's a ball and socket. So as it rolls through the joint, it needs to clear. Sometimes when the muscles like the deltoid or the pec are so overly dominant, it causes more of a malpositioning, pulling the humeral bone, which is the bone right here, all the way up in the socket, creating some pinching. So by me doing a downward force, kind of opens up the socket to allow the ball and socket joint to clear. Right, Shaun?
Yes, sir.
How does it feel now?
That was good.
Good.
I could just hold it if I wanted to.
Yeah, that looks much better. Good. Last one. Just kind of open up a little bit more. Just kind of get into that double front bicep pose. You know, we're holding into external rotation as I put a downward force within the humeral bone, and that's just again just to improve upon the joint mechanics, also nourishing the joint as well to keep it healthy. So people who are dealing with like arthritis, you know, or dealing with any pain associated with that, this is something that's definitely necessary depending on what your goals are with training. Awesome. Looks good.
That was good.
Any pinching in the back?
No, it's been good.
Good. That's also really important. So as you go into external rotation, if you can't get there, sometimes people will feel like a pinching in the back of the shoulder. So if you're trying to force something that's not there, right, the rotator cuff muscles, which are to allow you to externally rotate, will get pinched. And over time, that could create injury, and that can create a tear within the rotator cuff muscle. So again, the recovery and maintenance work is definitely beneficial, you know, to alleviate or prevent those things from happening. All right, let's go on your side facing that way for me.
You going to the lat?
Yep.
Okay. Let me keep my hand overhead or side?
Keep it on the side for right now.
Alright.
Get the tissue all gathered up here.
Ooh.
Okay, so now what we're going to do is work on Shaun's lat flexibility. Obviously, it's a big muscle that comes from the back and attaches all the way up into the shoulder. So as I was mentioning before, when this muscle is very tight, it limits your overhead mobility. So its job is to pull your arm down and by your side. So it's it's a counterforce to you reaching up overhead. So what we're going to now do is do some cupping. And cupping is just another alternative, another technique that I utilize to kind of help open up the tissue. So basically it uses a suction with air. It basically helps to separate the tissue layers from one another to kind of help everything to open up. So there's different ways of using it. You can either leave it and just allow the suction to do work and kind of bring the circulation to the surface, kind of regenerate healing, bring good blood flow in, or you can move it. Or you can even have the person move. So for Shaun, we do a couple of things. I move it along here, and again, just kind of like the Graston tools, it's opening up the tissue. And as you can see in here, it doesn't feel great at times. And that can be for many things. It could be because the tissue is just very bounded down and restricted. So obviously there's more discomfort associated to open up that tissue. But as you can see, like the skin is starting to get more red through it, so it's just showing that more blood flow is being brought to that area to allow for the tissue to heal. Sometimes people will see more darker discoloration, and that's called stagnation. So there's more stagnant blood within the tissue from just training, and if the circulation is not efficient, you know, that blood pools in that area. So basically the redness could turn to a dark hue, into a purple and something like that. So it's showing that there's more toxins within the tissue that need to be addressed so the muscle heals efficiently as we train.
Fuck. Is there cream on there or something?
There is cream. It's just tight.
Yeah, man. Like some baby oil or something. That shit. Fuck. Put Vaseline or something. Help me out, dude. That shit dry as shit. Okay.
Also, frequency is important. So, we've been working on a weekly basis, so obviously for individuals who've been training for a long time that haven't got any recovery work, or if you're only getting recovery work done maybe, once every couple of months, that's not going to cut it sometimes, especially because of the amount of stress and strain that you're putting on your body on a daily basis when you're just training. So I haven't seen Shaun, in about, a week or so, right? So even in a week or so, things are, more tighter than usual. And, that's why you're hearing him complain a little bit here,
I ain't complaining. You didn't put no Vaseline on that shit or something. I don't know.
I'm just kidding.
Ah.
Good, breathe. Good. Good. So what I want you to do now, I want you to actively move overhead. All the way up. Good. And back down. All the way to your pocket. Good. So again, this is another type of technique. It's an active release with the myofascial cupping. So again, we're pinning down the lat tissue as he reaches overhead. And it's also important when you're looking at the lat, yes, there could be restrictions more towards the hip, but a lot of people have a lot of restriction as it inserts into the shoulder. So you can kind of get a lot of bunching as you're reaching overhead. I can't get any more. It kind of feels like the tissue is kind of tearing. You've said that to me. It feels like it's a little bit of tearing. That's just the tissue trying to stretch out.
10?
Yeah, 10.
All right.
Good.
Ooh.
So as you can see, left a nice little redness through here, just showing that, there's some inflammation in that area. So the more discoloration there is, it shows more toxins within the tissue. And that's really important to note, because we want to get the muscle to heal properly. So good circulation through the cupping work really brings, nutrients to that area to get the blood moving. So again, we focus just more kind of up towards, the insertion into the shoulder. So it's also important to look at the whole length of the muscle, just like you train. You don't train in one position, you train the whole length of the muscle. That's how you get it to really pop.
Full range, people.
Full range, exactly. So,
half rep shit.
When you're lifting, you're stressing the whole muscle, all the muscle fibers. So, you can have a restriction anywhere along the whole width of the muscle or the length of the muscle that needs to be addressed. So we work on everything down into the lower back to open things up. And that's equally important too. So people don't realize while the lat can create shoulder discomfort, the lat can actually create low back pain because of where it attaches into the hip. So because it's so powerful, that when you reach overhead, you can start, if you can't go overhead, you kind of arch your lower back. So people who are having a lot of pain when they're squatting and trying to reach overhead, this is because the lat's not as flexible as we would like. So this is just a way to loosen it all up, to decompress the lower back, so that when you're squatting, we prevent any low back pain. So now I'm just kind of getting into the lower part of the back. So kind of also working on the spinal erectors, which are just muscles that help to keep you upright. When you see on stage, when people show off their back, these muscles are big, and what happens to you, we want to open them up. Because as you're trained, you're getting them to contract harder and look tighter, but also we want full spectrum. We want the full length of the muscle to show up. So you can see that when muscle is more tight, it's more impact, it's more dense. But we want to show the full span of the muscle by loosening everything up. Will help not only to decrease tension and stress through the lower back, but kind of open you up when you're doing your lat spread. I mean, Shaun will tell you when we first started, we saw that, he was favoring one side more than another. It was kind of wouldn't open up the way he would like. And so by doing this work, kind of opened him up. He could pose the way he wanted so that we're not losing points, on stage. Get these gloves on here. No, not yet.
Oh,
Cord is
shit.
away for right now. Basically, just gonna go into the rotators. Yeah. So now that we're on, working kind of on the back side of Shaun's body. So in his shoulder, this is where his external rotators are. Again, they help to stabilize the shoulder when you're lifting overhead. So as I reach in here and feel around, definitely the tissue is more restricted through here, very tight. Sometimes people don't realize that while they're experiencing front shoulder pain, and they're not sure where it's coming from, it can actually come from the rotator cuff muscle, because the way it attaches from the back of the shoulder blade all the way into the front of the shoulder. So people are, kind of get work done and they're like, I went and got PT done or massage work done, and they focus on the front of the shoulder where pain was, and it didn't make a difference. I still have pain. So it's now looking at other things like the rotator cuff muscle that can create pain. So when I feel in here, there's definitely more dense tissue. People term it as trigger points, nodules, which are just tight, dense muscle fibers, and it could create some radiating pain in the front of the shoulder. So right now I feel one. I'm on one right now. You can see Shaun moving his leg because it's discomforting. Are you having any discomfort in the front of the shoulder?
No.
Not right now. Okay, good. And that's probably because we've been working on it for quite a while now. But before, when I would push on the nodules of pain, it would radiate into the front of his shoulder, and that would be the replication of his pain. And he's like, wow, I never realized that something in the back of my shoulder can elicit pain into the front of the shoulder. So it's making sure you have something that is everything, and not just kind of chase where the pain is. There's other areas that can cause pain, but not be the area where the pain is actually at. Hence, pain in the front of the shoulder, but the cause is in the back.
Fuck. Shit.
And it's loosening, as I hold my finger there, just as a release technique, it's the tissue's becoming less tight, loosening up underneath my fingers. But also too, when you assess things and you're looking at things, there's also asymmetry. The body's normal like that sometimes, but there's sometimes that an area is more dense or tight than the other side. So we know that in the back, his right side was a lot tighter. This right side, into his rotator cuff is definitely a little tender. It definitely has some restrictions in there that need to be addressed to keep the rotator cuff healthy. It's not a glamorous muscle, meaning it's not like the showy, pecs, your deltoids. But it's a smaller muscle that really is probably the most important muscle of your shoulder, because that's what keeps your shoulder very healthy and safe while training. And obviously too, you hear these stories of people who have rotator cuff tears. We don't want that. We don't want to react to the rotator cuff tear. We want to be proactive to keep that tissue healthy, as it creates stability when we're training. So again, just going over with the Graston tool, definitely more restricted down into the shoulder blade. And this again is just trying to open things up, so when we get into that front double bicep pose, we can get there safely without kind of causing too much strain or stress at the shoulder when we don't have the necessary mobility. You feel the difference?
I don't feel anything. Really.
Yeah, it was like before I just pushed in there and I already got restriction. I'm able to push in there and I don't feel much. So it just shows me that this is an area that doesn't need much work. That's what I was saying too. Just like training, you prioritize, right? You choose the most efficient exercises to get the bang for your buck. It's just like when you get work done. It's assessing to see where you need it. Certain areas require more time than others. And that's why it's just important to have someone to kind of assess those things, so you really can make your time worthwhile and effective to get the best outcomes. And I think the biggest thing too with the work is understanding where someone's coming from. I mean, the reason why Shaun and I work so well is because I understand what the nature of his sport is. If you don't have someone that really understands the nature of your sport, that's going to have a missed opportunity. They can't really help you attain your goals fully because they don't really understand the nature of your sport. And I mean, Shaun could tell you, he's been around for a while, going to different people along the way. And, you have some people that don't know what you're doing, and for him, for his career and longevity, you need someone that understands what you're doing to really make the difference. Right, Shaun?
Yeah, I was going to say, I literally tried 3 or 4 other places, people, that had no idea what they were doing. You know, I explained to them what I did and the purpose of my visit, and it was just a waste of my time. You know, luckily I found you guys, you and Johan, who again understand my sport, understand what I'm trying to achieve, and what I'm looking for. So that's what the reason why I work so well together.
Yeah.
And not only that, guys, like Pete was saying a little bit earlier too, is you don't want someone who doesn't know what the hell they're doing either, because one bad move or putting too much pressure on a particular muscle could really damage things, especially when you have vascularity, the veins and stuff like that run into your body. Too much pressure on any area could cause a lot of damage.
Yeah.
People don't realize that.
Yeah. And I think what's also important too is the team dynamic. You know, it's obviously you as, the athlete, but if you have a coach, if you have, a nutritionist, and then, if you have someone like myself, whether it's like a physical therapist, chiropractor, I think it's everybody being on the same page and collaborating together, to best suit your needs. Everybody has an integral part to the overall success, of that individual. And I think being open-minded and respecting each other of where someone's coming from to better suit his needs or your needs, whoever's needs are, it comes down to just having a team of people that kind of know what your sport is all about and how do we help you to succeed and to achieve that goal of being number one.
That's the area I injured.
Right.
A couple years ago. So.
And everything's connected. That's the biggest point, is everything is interconnected. So you might have a restriction, in your hip, but then, you don't know that until your shoulder is bothering you. And everything has, a connection. So something here can cause the root pain here and vice versa. So it's really important that we're assessing all that and looking at all those things to make sure that we're not missing anything. You're treating the whole person. You know what I mean? You're not just treating the area that may be painful because you're chasing pain. And we don't want to chase pain. We want to find the root cause of it to eliminate it, and to make sure that things are properly moving the way they should be. So now what we're going to do, we're going to just do it's a percussion, a deep tissue kind of massage, just kind of open things up. It uses vibration, so the vibration is just going to allow for the tissue to calm down, kind of bring blood flow to the tissue, just to kind of open everything up. And now that we just worked on it and get just kind of the blood flow, everything circulating to heal the tissues that we just worked on. And obviously too, like, this might seem pretty basic or simple to use, there is an expertise to it as well. There's certain areas of the spine that you don't go over, so I put my hands here just to kind of make sure that I'm not hitting any bone, because that can hurt, Let's say you do have an injury or whatever, and, you had surgery, and I go over an area that, that was just repaired, that creates an issue, So it's important that you're just constantly assessing and having someone that knows what they're doing to kind of really make sure that that the patient or client is safe, throughout, their recovery session. And Shaun will tell you, again, like, there's some people out there, that, don't know what they're doing. And, we really want to make sure that, if you are entertaining the idea of having someone to do recovery work or maintenance work, or if you're dealing with an injury, really do your research. It's worth the time, and it's worth really investing in the right person, like we said, to really optimize your overall health.
All right, guys, and that is a wrap here today. Again, big thank you to my man Pete for obviously being part of the team, keeping my body healthy, keeping me just training hard, heavy, and intense as we're getting ready for the 2020 Olympia. As you guys saw today, we focused on upper body, just being more so the main areas, the pecs, the delts, the back. Those are real key areas that, for me personally, always seem to get really tight. Mm-hmm. And obviously, there's a lot more content coming, working more so in the lower body. But again, training upper bodies, obviously we're training back, we're training arms, we're training shoulder, we're training chest. Those particular body parts take a beating every single day. And so for me personally, I like to give more attention to those areas than I do my lower body. What do you think about that?
I agree. I think what's most important, and again, is prioritization.
Yes.
I think that there's a a lot of body parts to work on, you know, and I could spend as much time as I need to work on everything, but, you know, there's only a certain amount of time that we have to really focus on a certain area, and we want to optimize that. So I can work on everything, but we really want to prioritize one area at a time, or maybe 2 body parts at a time, because there's a whole lot of body, and we want to give it our all versus kind of, you know, bits and pieces here and there, and you're not going to get the same benefit. So that's why we kind of focus on more of the upper body today, and other videos that we'll put out there will be focusing on other body parts to kind of showcase, okay, what we're doing for the recovery session based on each body part, and then also too, what associated injuries are associated, you know, with those different body parts, specifically predisposed for those who are, you know, weightlifters, bodybuilders, athletes, and kind of go about how do we go about treating those things, you know, for the future. So stay tuned. We have a lot of content for you. You know, if you guys have any questions along the way, feel free to DM me or Shaun. Please leave some comments below, and we'll be you know, really happy to get back to you and answer those for you. So stay tuned.
So again, guys, if I had to give one piece of advice to the younger generation is take care of your body early. Get the deep tissue work, get the grasping, get the cupping, get the stretching, get things like this. People like Pete in your corner who can really, again, prevent things from happening to increase longevity. Again, big thanks to Pete. I hope you guys enjoyed this content. Again, Pete is available if you guys need information. Hit him up. He'll definitely contact you back. And again, I hope you guys hope this content, again, will give you content from every angle. I was getting ready for Olympia. You're getting training, you're getting posing, you're getting this type of stuff. So again, leave a like, drop a comment. Let me know what you want to see next. And again, we'll see you guys soon.